Hey guys, Jill here from Ask a Vet Tech. Today we're going to talk about dental health, and February is Dental Health Month. When we talk about dental health in cats, we normally don't notice anything until there's a big issue. Cats are wonderful at hiding issues from their owners. Normally, cat dental health starts to decline around 5 to 10 years old. I'm going to educate you today on different issues that cats can get and what to watch for. The first thing that most people notice is their cat having terrible breath. These issues could be from a lot of things: plaque, tartar, gingivitis, stomatitis, oral sores, retained baby teeth, or other underlying organ issues. So let's get started with tartar. Tartar is a super hard, yellowish substance that has a very strong attachment to the cat's teeth. It is caused by plaque or food particles, bacteria, or even minerals in your cat's saliva adhering to the teeth. Tartar alone is an issue when it touches the gum tissue. The body kicks in the immune system to fight the irritation, causing this next issue, gingivitis. The accumulation of tartar that starts to collect on its own, on itself, and slowly ending up under the gum tissue because it just kind of progresses downward. Most of the time, gingivitis accompanies infections in the mouth, creating gum disease or periodontal disease. Major cat mouth issues come from periodontal disease. It happens when the tartar on the teeth has not been dealt with in a timely manner. The body decides it has had enough and it sends tons and tons of white blood cells to the gum tissue to try to fight it. When the white blood cells start to work, they create a harmful toxin that can easily get into the bloodstream at this point because there's sores and open skin and a lot of irritation. These toxins create a systemic infection that affects vital organs, such as the heart, the liver, and the kidneys, which can be fatal if left untreated. The infection-fighting white blood cells can eat away the infection of the gum tissue and all other tissues, leaving bones and supporting tooth ligaments exposed. As you could imagine, that would be super painful, and a lot of owners will find loose teeth just around their house when they have this issue. The next issue I want to talk about is called stomatitis. This is a very complex, frustrating issue for your cat and the owner. Many issues arise from it. It causes many cats to just completely stop eating and drinking, and there is always way more drooling. It's just a giant side effect. Stomatitis causes the entire mouth to become inflamed. The gingiva, or the area surrounding the teeth and the tongue, the lips, and the whole skin surface inside of the mouth. This affects around 10 to 12% of the cat population. So how and why do they get it? Most of the time, they've been infected with a viral disease such as feline immunodeficiency virus, or FIV, and feline leukemia, or FELV. Could also have been exposed to calicivirus, or it could just be something genetic that they're stuck with. If your poor kitty has been diagnosed with this, the gold standard of treatment is to check for underlying disease processes and remove all the teeth in the mouth. A full mouth extraction. I know what you're thinking, oh my gosh, how are they going to eat? Well, it seems extreme, I know, but having teeth that are infected and whole mouth issues, sores, is way worse. The gum tissue and the palate stiffen up, so it's almost just like eating on a hard surface again. They can still eat crunchy food. Most owners do feed soft food, but that is just a preference for you and your kitty. And without having teeth in the mouth, they can no longer become painful and infected. Sometimes, stomatitis can seem to spread in a multi-cat household. Not because stomatitis is something that you can pass on, but it is usually the underlying sickness that is passed on between other cats. Cats will groom their sick housemates, leaving the caregiver kitty susceptible to getting sickness as well. Make sure you see your vet and make sure all your other cats are up to date on vaccines as well. Sores that are found in the mouth, or oral sores, can make your poor cat not want to eat or drink. They may drool a lot. Things that we see in vet med that cause this can be bad teeth, a cyst in the mouth cancers, or tooth root abscess. There are also other causes it could be, such as the herpes virus, calicivirus, feline leukemia, or feline immunodeficiency virus. Sores can be red and swollen, White or yellow gum tissue may be seen. Most cats cry or vocalize because it's so painful and frustrating to them. And the last, less scary issue I want to talk about today is retained baby teeth. Deciduous teeth are tiny little baby teeth that have never made their way out of the mouth, and the adult teeth have made their way in. So sometimes it creates a pocket for food and debris to get in there, creates kind of a smelly mouth. Basically, they just need to get those extracted and maybe some pain medicine and antibiotics, and they're good to go. So hopefully today I helped you learn something about how to take good care of your kitty's mouth. Your best defense is a great offense. Brushing your cat's teeth definitely helps to keep them nice and clean and keep the tartar and plaque from building up. There are also many different types of kitty chews that you can give to your cat to help reduce the amount of debris that stays on their teeth. And they love it. If you notice your cat doing any of the following, it's time for a visit. Pawing at their face, drooling, eating less food, eating on one side of their mouth only, having a hard time picking up their cat food, depression, less energy, aversion to you touching their face or not wanting to be touched in the mouth or the face area, and a smell. Get your cat in yearly for an oral exam and get those teeth checked out. Make sure you do the best for your kitty. If you have any questions or comments or new topics that you want me to address, please leave them below. I'd love to hear from you. And if you haven't already, please subscribe and like this video. It really helps me out a lot. I just want to remind you, I'm here for you. You're here for your pet. Have a great day.